Regular viewers of my channel will know that acting on your negative thoughts is what gives them power and fuels your anxiety. But there is a gap between your thought and your action. In that gap, anything that can help you choose not to take the action will help you get control of your anxiety. Stop is a simple technique taught in CBT to interrupt negative thoughts before they take control of you. It does not matter what type of anxiety you have, panic disorder, GAD, social anxiety or OCD, Stop works for all. This is how it works. The S stands for stop. As soon as you notice the anxious thought, say to yourself, stop, and pause for a moment. The T stands for take a breath. Breathe in through your nose and out through your mouth. Don't force your breathing, just observe it. O is for observe. What are the thoughts going through your mind? Where is your focus of attention? What are you reacting to? What sensations do you notice in your body? P is for pull back and get some perspective. Remind yourself that just because you get a thought, it doesn't mean it's true. Try some of these questions and see which ones help. What would a trusted friend say to you right now? What advice would you give a friend in the same situation? Is the thought a fact or opinion? What is a more reasonable explanation? How important will it be in 6 months' time? The second P is for practice what works and proceed. Ask yourself, what is the best thing to do right now? If you've watched a lot of my videos, you'll probably know the answer. What is the most helpful thing for me, for others, or for the situation? What can I do that fits with my values? Where can I focus my attention right now? Then do what will be effective and appropriate. Here are two more examples of stop being used for different anxiety disorders. Larry suffers social anxiety. As he is walking along the road, he spots a neighbour. He suddenly thinks, he will talk to me and I will freeze and blush and he will laugh at me. Larry gets the urge to cross the road to avoid the neighbour, but instead he uses stop. He stops, pauses, takes a breath, observes the negative thoughts, and notices his heart beating faster. Then he pulls back from the thought to get perspective. It's just a thought, he says to himself. Doesn't mean it will happen. My best friend would tell me just to say good morning and smile. Even if I blush, the guy is unlikely to remember it in 6 months' time. Then Larry moves to practice what works and proceed. Larry decides it would be rude to ignore the neighbour, so he decides to smile and say hello. The neighbour smiles and responds. It's over, and wasn't as bad as Larry feared. He feels a little bit proud of himself for not avoiding the situation like he always has in the past. Donna suffers health anxiety and panic disorder. She gets the thought that if she goes in the supermarket, she will have a panic attack and have a heart attack. Using the stop technique, she stops, pauses, takes a breath, observes her thoughts, and notices the tension in her body. For perspective, she asks herself, what did my doctor say? He said I'm young and have a strong heart. She asked herself, would it matter in 6 months? She concluded it would just be one of the many panic attacks that I have had. She decides to practice what works. She knows from watching my videos on panic attacks that the best thing to do is not rush, drop her hands to the side, release any muscles that are tensing, and focus on the task of shopping without checking the exit or her pulse or anything else that reinforces the fear. Donna feels a little shaky but manages to do her shopping and feels that she's achieved a little victory. If you would like to try using the stop technique, you will find stop cards and information sheets on a great website called getselfhelp.co.uk. You'll find a link in the description. Don't worry if you forget to use stop sometimes, just try to remember it the next time. Write it on your hand maybe, or put a stop sticker on your phone. The more you practice using stop, the easier and more effective it will become.